And to begin the hour, we meet a forward-thinking doctor who combines the best of orthodox medicine with alternative approaches to help his patients fight diseases like cancer so they can make the best treatment and healing decisions. Stay with us for a visit with Dr. Walter Lemmo. Dr. Lemmo holds a degree in biological sciences and is a board-certified naturopathic physician in BC. In his healing practice, he cares for many people with cancer who believe in integrative care, which combines the best of complementary, alternative, and oncology medicine. It is my pleasure to welcome Dr. Walter Lemmo to Studio 4 to tell us more.
Thank you.
Nice to meet you. Why did you pick naturopathy?
The classic question. I think a lot of us get into the field sometimes from our own personal reasons. I was born with a lot of allergies and hay fevers as a kid. Growing up throughout all the years suffering, the conventional model didn't really work too well. Someone says, go see a naturopathic doctor. I go, what the heck is that?
Who?
Exactly. And then they started talking about how diet and lifestyle incorporated into your health. Like I didn't know, for example, being a teenager and if you had a few beers, has grasses, wheat, and water, all these other chemicals in there. I never knew it had an impact on my health and my allergies. And so you learn about all these types of variables and bingo, it was a field that really resonated with me. Hung out with naturopathic doctors, loved the creativity, loved the style, and that was the path I chose.
So the fact that you could have been allergic to hops may have started you on this journey. Integrative medicine, the philosophy, the approach, what is it, basically?
Well, basically what it is putting the patient, the person in the center of incorporating all these types of healing philosophies and empowering the person. It used to be called before alternative, but alternative means either or.
Right.
And then this other phrase popped up called complementary. And complementary would probably be like, say, it's not a lot of substance in that word. Say you had a meat with like potatoes and pasta in there, and then complementary would be the parsley on the side. And so then the term came up, integrative, where they're all important, kind of bridging them all together and trying to create a program that's individual for you. So it's empowering the person and appreciating that all these healing philosophies are important and they have a variable in improving your health and treatments and et cetera, et cetera.
The Integrative Healing Center is now called Inspire Health. You work there 1 day a week?
That's correct.
Along with medical doctors, homeopaths?
There's no homeopath. There's traditional acupuncturists, there's massage therapists, there's nutritionists, there's yoga, there's music therapists, all working together to provide options for patients with cancer.
Okay, all part of the healing picture. So someone gets a diagnosis, they have a cancer of some sort.
Right.
When should they call Inspire Health? At what point does Inspire Health get involved or should get involved?
Right away. It's really, it comes down to the individual and where they want to go, where their comfort zone level lies. But let's face it, when you get this diagnosis, the big C word, a lot of things go through people's minds. It affects their body, their physiologies, the families, the friends. And so you can get support just from that perspective alone. And then you want to find out, say, well, what are my options? What's something that I could integrate into that model where you're comfortable with, not comfortable with, and you could explore those directions, And so that in essence, you can build a framework of where can I go? Then there are those that say are in active treatment. Maybe I just want to minimize some of the side effects of the treatments or whichever have you, and that's an option to go. There are those that may be not responding too well to treatment, and they're trying to find other ways to enhance their healing journey. And so in essence, you use it before, during, and after.
So creative ways to deal with the fear factor, number one. Accept the diagnosis, defy the diagnosis, eventually beat whatever little creature is in your body or not. But who to trust is a big part of it, and what treatment to take. As you know, the doctor dance is going to many different places, and they go over you with a fine-tooth comb, and then they come up with a plan.
Right.
And so the plan could be some chemotherapy, some radiation, surgery. Where do you fit in that? Say somebody has to have surgery, and they come to you and they say they're going to remove part of my lung.
Right. Well, remember one thing is that there are the beautiful thing about integrative medicine is that there's many types of approaches for each individual case. Some, for example, just talking about fundamental things, moving more, eating right, could be huge impacts in terms of trying to support immune function, support wound healing. Watching the stresses, obviously, is the kind of a no-brainer things. That supportive quality could be huge in impacting people. Then, for example, for those that are wanting to say, you know, I want to enhance healing on another level. Say if I wanted to take certain supplemental things. Say I wanted to try acupuncture. Say I wanted to try certain diet regimes. Say I wanted some help with physical activity. These are the things that you try to do. So it's not so much say, there isn't a cookie cutter approach that you say this is, you do this, you do that, you do this, because we're all different. We have our own fears, we have our own concerns. Some people don't want to go that far. You know, I just want to do basic things, not too complicated, a bit more conservative, and that's fine. And there's the other spectrum where they're going, you know, I want to try more things to optimize my healing abilities. I hear about these things that are published in the research that may be considered experimental, like IV vitamins or whatever have you. And I like to see if that could fit into my paradigm.
Because as you know, when you get a diagnosis of cancer, everyone has an idea of how to help you.
Of course.
From the photon genie to the special syrup to the eat an apricot pit. Yes. I don't know.
Absolutely.
But it's good to do research. Of course it is.
You know what it is
but
that
it's also confusing.
Absolutely. And that's part of what we tend to do is that there's a value in having an expertise in cancer care. So 95 of the patients I treat is cancer. I see about 60 to 70 patients a week. And what I try to do is just trying to, you know, there's that hurricane concept, you know, where there's like big hurricanes and at the center it's calm, you know. We try to create that calmness, evaluate the informations, and try to find a treatment program that works for you. And so we try to dispel some of these myths like, yeah, the photon genie or this product is the cure or this treatment, you know, facility in Europe is the way to go. And you can do a lot of these things that are not too complicated to give you the best possible outcomes and decreasing complications and improving quality of life.
Okay, example, and this is a makey up.
Sure.
Example, prostate cancer, one of the treatments is radiation. Side effects, obviously, some. So you as a naturopathic physician would say, here are some ways you can make it a little easier.
Absolutely.
Help your body a little more during the treatment.
Yeah, like for example, again, if you're looking at a lot of research right now that's coming in medicine, period, fundamentals are always the key, and it's coming up more and more. Like say, for example, physical activity in cancer care was told, it doesn't do anything, you know, what's the deal here? You know, does it have an impact or not? And we're noticing, say, with radiation, what are the two things that make radiation work better? Oxygen content and blood flow. We know that conventionally. And so what are the things that we...
You know that.
Yeah. You know,
really?
Well, radiation oncologists know that too, actually, and we all know this. Where the controversy lies is how do we do that? You know, and that's where it lies. But so what are some basic things that we can do? So we know, say, physical activity, moving around, movement. We know that helps to support the hemoglobin levels, keeps the body more supported, helps protect the healthier cells, helps to minimize fatigue. We know that. The data supporting those type of things.